Well, good afternoon, everybody, and welcome. We're so excited that you are joining us, and we thank you for taking your time to come to Mission West Virginia's webinar today. The webinar is on self-harm, and it is going to be conducted by our own Miss Autumn Wagner. So, okay. But first, a little bit about who Mission West Virginia is. Some of you know who we are, some of you don't, so we'll do a quick synopsis. West Virginia is leading a statewide effort to promote positive futures for all kids in West Virginia, especially adolescents. We work with families as they navigate the foster care system, and we provide evidence-based life skills and relationship education to help teens envision their future and create positive and healthy relationships. As a result of our work putting kids first in collaboration with social services, school districts, private foster care agencies, and other nonprofits, the future is looking much brighter for West Virginia families. Our framework side provides a support for those interested in foster care or kinship care to help them understand the system. It can be a complicated system to navigate through if you're not familiar with it. We help them find placement agencies, and we prepare them to help make a difference in the life of a child. If you're interested in fostering, our information is on the board here, or just even an adoptive parent, you are in the right place. And if you want to speak to someone, call 866-CALL-W Mission West Virginia MWV or 304-512-0555. Or at missionwestvirginia.org, you can request information packet on our website, and we will have people who can help you find out more information. Our THINK program stands for Teaching Health Instead of Nagging Kids, and we empower the teens to make positive life choices through education, life skills, and life coaching. Our program is evidence-based, and it helps the students we work with to navigate emotional pressures that all teens face as they develop. I mean, we were all teenagers once. We realized how difficult those years were. This also includes building healthy relationships and healthy choices around high-risk behaviors such as drugs and alcohol, and teen pregnancy prevention. We deliver our program in partnerships with schools right now in 20 counties. We are vetted by district leaders, teachers, and other school leaders who are trained to work with kids. It's a curriculum-based curriculum, and it has been shown to have a positive effect on preventing teen pregnancies and sexually transmitted infections, or, risky sexual behaviors. Our educators are continually trained on the most updated information on trauma, sexual health, and high-risk behaviors. And our management team, to ensure fidelity and adherence to the curriculum, we do on-site observations to make sure everybody's receiving the same program. We also administer pre and post surveys. We receive teacher feedback. We hold teen focus groups, and we do site surveys. And we know it takes a whole community, and I'm so excited to see the diversity of those who had chosen to attend today. But it takes a whole community to help teens envision and create positive futures. And we do provide some resources to train and equip parents, families, and other individuals who support children as they navigate their teen years. We do workshops and trainings that include talking to youth about sensitive subjects, hidden in plain sight, trauma, sexual assault prevention, consent, teen dating violence, and so much more. And self-harm is one of those that we also offer also. And we want to thank FRIZ, which is the West Virginia Foundation for Rape Information and Services, for co-sponsoring this event and also providing CEUs. There is a thing, if you have multiple people watching this on the same computer, we need you to respond to rwhite@missionwv.org, or in the follow-up email that you will get with a SurveyMonkey link. You need to let her know who all was on that one computer watching, just so we have accurate attendance records. And if you've requested CEUs, that we can make sure everybody gets their CEUs. And to get a CEU, you must, as you're used to, do the survey that comes. And once we get that back, we will work with Frizz and get those out as quickly as possible. We will offer CEUs in social work and nursing. And I think I just said all this. You must complete the evaluation in order to get it. Or you can also take a picture of this QR code. It'll take you straight to the survey, and we'll also drop it in the chat box, and you can pick it up that way if you like. Or you will receive a follow-up email with the link. So we give you 3 different ways, 3 different reminders to make sure you do that so you get the CEUs that you need. And before we introduce our speaker, we have such a large participation today, and we're so excited about that. We will ask if you will put your questions in the Q&A section, and then Autumn will follow up. Hopefully, her schedule's pretty packed, so within about 10 days, she'll follow up with a comprehensive answer to most of your questions. So feel free to drop those in the Q&A. Or in the chat if you're not familiar with Q&A, and we will do our best to get you answers for those. So without further ado, I'm going to introduce Mrs. Autumn. She is our Youth Resource Coordinator here at Mission, West Virginia. She has her bachelor's and master's in social work from the University of Akron. Oh, sorry. From Akron. Yeah, I'm not very good with technology, so excuse this. And she is a licensed social work in West Virginia. In her position here at Mission, she works with students who identify as needing resources or community referrals. She also provides education on numerous topics, and you will see her in the coming months doing more for Mission West Virginia, more of these webinars. So if you like what you hear today, make sure you tune in for the ones that we have coming up. And she also acts as a bridge of support for students needing just a trusted adult to speak with, and helps them work through any difficult situations that they may be experiencing. So we're very thankful to have Miss Autumn on our team. And with that, I will let her take over. And what we're all here for is to hear what she has to share.
All right. Well, thank you everybody for joining. I am so excited to be presenting on this topic today. And I know just from my experience, and I'm sure a majority of yours, you may have come across somebody, whether it's somebody in your area of profession or someone, personally close to you that may have experienced self-harm. And I have found that this problem has been on the increase for quite some time, especially with our youth. So that's why I wanted to do this presentation, because I always hear so many questions about self-harming, like exactly what it is and why do people engage in self-harming. And so we'll talk about all of that stuff. So I'm going to go ahead and share my screen. All right. Miss Becky and Rita, can you guys see my screen?
Yes, we can see you.
Okay, perfect. Okay.
You get started there, Autumn. We're getting reports of some lag. So if people want to turn off their cameras, that might help with that.
Okay. All right. Yeah, I'm going to go ahead and turn mine off just because I know there's a bunch of us here. Okay, so we'll go ahead and get started on self-harm. All right, so just a little bit about me. I always love when I go and see people present. I always like to just hear kind of their background story and stuff like that. So again, my name is Autumn. My hometown, if you are familiar with the amazing accent that I absolutely love here in West Virginia, you will know that I don't have that, unfortunately. I try, but people call me out on it because they can all tell it's fake. But I am not from West Virginia. I was born and raised in Akron, Ohio. I lived there my whole life, and I disliked everything about it. So I finally took a chance and I moved to West Virginia in 2019, and I absolutely love this state. I live out in Calhoun County, little teeny tiny town called Arnoldsburg, and it's very peaceful and quiet. My education, I have a bachelor's and master's in social work, and I'm a licensed independent clinical social worker here in West Virginia. And my previous experiences, I've worked with older adults, I've worked in addictions, corrections, mental health. And then before I came to Mission, I was an adult and adolescent therapist. And then before I became the youth resource coordinator, I was an educator for our Think program. So I went around teaching our healthy relationship curriculum to our high school students. And then I transitioned a little over a year ago into the youth resource coordinator. So I work with students one-on-one, and I absolutely love what I do. Anytime I do presentations on mental health, I always put a disclaimer that the presentation should not be used as a diagnostic tool, but used just for educational purposes. I will also be talking about, sensitive stuff such as self-harm, and there are, some pictures that may be triggering. So I always ask that participants, please take care of yourself. I do not know everybody's stories, and so I know sometimes things can just make us upset. So please do what you need to do to take care of yourself. And if you have any mental health concerns for yourself or someone else, please make sure that you are receiving proper assessments, diagnoses, and treatment from a licensed professional. I know before I got into this work, I identified as a physician because Google had all the answers for me, and Google was always wrong, and it made my anxiety worse. But I still always like to, self-diagnose. So, but now that I'm older, please do not do that, and make sure that you are getting treatment from the proper professionals. So when we look at self-harm, really self-harm is hurting yourself on purpose. They also have other terms for this. So they might call it a self-injury, or the big one that they use a lot is NSSI, which is non-suicidal self-injury. And when people injure themselves, there are typically there are more common places on the body where someone might injure themselves. And those places would be their hands, their wrist, the stomach, and the thighs. But people who injure themselves can basically injure anywhere on their body, but the hands, wrist, stomach, and thighs are typically the more common places. One thing that's really important is self-harm is not a mental illness. So there is not an actual self-harm diagnosis. Usually it comes along with other mental health issues, and it's really common for people that are experiencing depression, anxiety, trauma, eating disorders, also some mood disorders like bipolar, and as well as some personality disorders. Self-harm can be very common with that. Really, it's just an unhealthy way to cope with emotional pain, intense feelings, such as anger, frustration, depression. And this is how a person releases those intense emotions and how they cope. The other thing about self-harm is people that engage in self-harming, it's typically not an attempt for suicide. A lot of the people that I've worked with that have a history of self-harming, the majority of them said that for them, it was just a way of releasing emotions. They in no way had any thoughts of wanting to end their life. So some people that aren't familiar with self-harming might look at that as someone's attempting suicide. In most cases, self-harm is not a suicide attempt. It's more about just releasing those emotions and trying to cope. So when we look at who self-harms, unfortunately, just like when it comes to suicide and mental health and addiction, self-harming doesn't discriminate. There is no type of person that is immune from starting this behavior, but the rates do differ among certain populations. So when we look at adults, aside from really, really young children, adults are the least likely group of people to follow through with self-injury, and only about 5% of adults have self-injured in their lifetime. Teenagers. So teens have the highest rate of self-injuring behavior. There's been about 17% that have admitted to injuring themselves at least once in their lifetime. And again, that is 17% is only those that have admitted. I honestly think that number is probably a lot higher. It's just there are lots of people that keep this from other people. They hide it, keep it a secret. College students, the studies have found that 15% of college students report engaging in self-harm. When we look at women versus men, women are more likely to self-harm, but males also represent at least 35% of the total self-injury cases. So it is something that males can engage in, but they're more likely to underreport self-injury than women. And that is common for a lot, especially when it comes to mental health. It's more common for men to underreport just for so many reasons, whether it's, ego or the stigma or, society puts this thing out there that men, have to be tough and they can't show emotions. So there's lots of reasons why it's underreported for men. And then also sexual minorities. So anybody that is part of the LGBTQ plus, they are at a high risk of self-injury, and almost half of all bisexual females engage in self-injury. So as you can see, it doesn't just happen to one group or, it's prominent in another group. It can happen to anybody. So when we look at self-harm, there's actually a cycle. It's a very, very vicious cycle on how it works. And so typically what can happen is, as you can see, there is a little chart there that shows how the cycle works. And so somebody might go through an experience that, creates an overwhelming amount of emotions, typically a negative emotion or an emotion that's not so good, such as anger, frustration, or pain. And so as time goes on and those emotions build up and they have no idea how to work through that, they might start engaging in self-injury behaviors. So they use it as a way to kind of release, those emotions and those feelings. Some people, when they injure themselves, it creates endorphins. So it's their body or their brain starting to pump out those endorphins or the pain-killing hormones. And so for a short period of time, it might actually make them feel good. It might raise their mood a little bit. Or if they don't feel emotions, they might cause themselves pain because they just want to feel something. It doesn't matter what kind of pain it is or what kind of feeling, they just need to feel something. So they might also engage in self-harm. Once a person injures themselves, they typically go through a period where they feel guilty or they feel ashamed of themselves. So again, that guilt and shame is going to lead to intense emotions. And then that cycle starts over where they hurt themselves again. Self-injuring is a very dangerous cycle. And for some people, it becomes a long time habit, and other people create rituals around it. And I've also have worked with people where for them, their self-harming was kind of like an addictive behavior. So, it's kind of like that addiction to that feeling was there. It's just instead of, that substance being alcohol or drugs, their addiction was self-harming. So this is just a little video on self-harm.
Self-harm is when a person physically hurts themselves without the intent to die. The official clinical term for self-harm is non-suicidal self-injury, or NSSI. Self-harming may look different for different people. The injuries may be minor to severe and sometimes result in scars, bruises, or health issues. Self-harm usually begins during adolescence or early adulthood, but it is a behavior that can occur in people of all ages. Research shows that young people that are bullied are at higher risk of self-harming. A common misconception is that people who self-harm are all suicidal. Although self-harm is associated with an increased risk of suicidal impulses, there are many people who self-harm who will never have serious suicidal thoughts. It is often used as a way to cope or express feelings. Some reasons a person may self-harm are to relieve stress, distract from memories of traumatic experiences, feel in control, release or avoid feelings that are overwhelming or cause anger, communicate the pain they are feeling in a visible way, or punish themselves. Although it can seem backwards, for people that self-harm, the act of hurting themselves can actually help them feel better in the moment. Some of the signs that someone may be self-harming are frequent cuts, burns, bruises, or scars, particularly on hands, wrists, stomach, or thighs. Wearing clothing that is not weather appropriate, for example, wearing long sleeve shirts and pants on hot days. Making frequent excuses about injuries. Carrying or having sharp objects without a reason. Although self-harm is a behavior, it could be linked to a mental health disorder, such as depression, an eating disorder, post-traumatic stress disorder, or borderline personality disorder. Treatment provided by a licensed mental health professional can help stop the person from self-harming. Through mental health counseling or therapy, the person will be provided with tools to learn problem-solving skills and healthy ways to cope with their feelings and emotions. Talking about self-harm may be difficult. If you believe someone you know may be self-harming, reserve judgment and encourage them to talk to a licensed mental health professional. If you're a mental or behavioral health provider seeking information on evidence-based treatment, check out our multimedia solution for continuing education and shareable patient resources at psychhub.com.
All right, so when we look at forms of self-harm, there are actually lots of ways that people can engage in this behavior. The most common and probably the one that most people are familiar of would be cutting, using some type of sharp object to make cuts or severe scratches on their body. Scratching. And so with the scratching, sometimes they might pick a place on their body and they just scratch, and they keep scratching until they break the skin. Burning. So this can be done with matches, lighters, cigarettes, or any sharp object that is heated up, such as knives or maybe like the end of a scissor, and they use that to burn themselves. They might carve words or symbols on their skin. And a lot of times as it heals, it'll scar. So you'll, see that. There's also the self-hitting, punching, or the constant banging of their head against another, like a wall or a door, another hard object. Using a sharp object to pierce their skin, and binging and purging. And so they're still doing some study with the binging and purging form of self-harm. But, I did a presentation on eating disorders, and of course, binging and purging is a part of bulimia. And so, the binging and purging is part of that eating disorder, but there are some people that actually binge and purge as a way of harming themselves, but they don't necessarily have an eating disorder. So they're just using that as a way to cope. So we have risk factors that puts people at a higher risk for developing NSSI or self-harming behaviors. So if they're experiencing feelings of defeat, entrapment, hopelessness, rejection, shame, or loss. If they feel like they're a burden to others, or a need for self-punishment, or a desire to escape unpleasant feelings. So a lot of times people that self-harm, they will blame themselves for things that have nothing to do with them or are beyond their control. So they feel that they have to punish themselves by self-injuring. There's feelings of loneliness, social isolation, or social disconnection. So, especially with our youth in the schools, if there's some of those students that don't have a good social support in the school, they typically tend to be by themselves more often, or don't engage in anything or any other activities within the school. Mental illness. So again, that's depression, anxiety, borderline personality disorders, eating disorders, and also bipolar. Life stressors. So if there's problems in relationships, a history of trauma, any bullying they may be experiencing, if they're engaging with drugs and alcohol and having problems with that, a family history of mental health problems, problematic social media use, especially with cyberbullying. And I'm actually going to be touching base on self-harm and social media here in a little bit. Perfectionism. So perfectionism, of course, we all want to do things perfectly, but it can get to a point that that perfectionism becomes so much that it turns into an unhealthy thing. And basically it's wanting them to meet other people's expectations, or if they feel the need to want to please others, they might put a lot of pressure and stress on themselves to be perfect in all the things that they do. Just being impulsive by nature. And so we see this a lot, obviously, with our youth because their brains have not fully developed. We typically call that teen brain. So during teen brain, the part of their brain that allows them to make those good judgment calls, and they're able to reason and think about consequences, it's not exactly fully formed. So that's why we see impulsivity more commonly in like with youth and teenagers. And then being exposed to self-harm or suicide of family and friends. So when we look at some of the symptoms, the most common one is going to be scars, and it's typically shown in patterns. So I had mentioned that sometimes they might carve symbols, or things on their skin, but the other patterns can be just kind of straight lines going up their arm. Or their thigh or stomach, wherever they cut. There might be fresh cuts, scratches, bruise, bite marks, or other wounds. Excessive rubbing of an area to create a burn. Maybe they have sharp objects on hand at all times for no reason. Wearing clothes that are not appropriate for the season. So, in West Virginia, it can get pretty hot and muggy during the summertime. So if there is somebody that during those days are wearing hoodies, sweatpants, things like that to cover up their skin, might be of a concern. Frequent reports of accidental injury. So if somebody has all of these cuts and scratches and bruises, they always have reasons or excuses as to why that's there. So it's, well, I burned myself when I was cooking, or my cat scratched me, or my dog scratched me. I fell and, hit myself. So there's always a reason as to why they have all of these cuts and bruises on them, and it's just, this doesn't seem like, that would be right. Difficulties in relationships. So this can be very common with self-harming. Really, any other type of like self-harm, like binging and purging, and even like addiction, anything that somebody's trying to keep a secret. They typically do not go around telling everybody and anyone that they engage in self-harm. So a lot of times this is held, this is kept to themselves in a relationship. And so it's like they're trying to put on this front that everything is okay, but the reality is everything is falling apart. And eventually that's going to start hurting that relationship. There's going to be some issues because when somebody is greatly suffering mentally and emotionally, it's going to be really hard for them to keep up with that front that everything is okay. And then also if they make statements of helplessness, hopelessness, or worthlessness. So when we look at why people self-harm, I know when I was growing up and I didn't know a whole lot about self-harm, but I've heard about it, but there was always this like negative attachment to it. More of like, obviously it's not a healthy thing to do, but meaning that there was just this stigma that, the people that, hurt themselves or cut themselves, they're crazy and all that. But, now that I know more about it and I've worked with people that do engage in self-harm, You can just understand it a lot better. But really, it's just, we all need a way to cope with our emotions, whether it's healthy or unhealthy. Of course, we always hope that we are coping in healthy ways, but sometimes people find it easier to engage in those unhealthy things. So people who self-harm, they turn to hurting themselves as a coping mechanism and to manage their emotions. So when people are self-harming, they're doing it for a number of reasons. So first, it's helping them to process those negative feelings. It helps them, when they hurt themselves, it kind of clears their mind for a brief moment. So they're able to process the things that are going on in their life. They might self-harm to distract themselves from the negative feelings. So again, they're tired of feeling that emotional pain. So they want to feel a different kind of pain. So once they cut themselves, burn themselves, or whatever they do, it's going to distract them from those negative emotions because they're feeling that physical pain. So that again, they want to feel something physical, especially if they feel completely numb. Most people don't like feeling numb to their emotions where they're just kind of like zoned out all the time. So they want to feel something. I worked with some people that for them, it made them feel like they were alive because their mental health was so severe. They said they felt dead inside, and that's kind of how they perceived, their view on everything. And so when it got to that point where they had no emotions, they just wanted to feel something because they were tired of just feeling that emotional numbness. Some people might engage in self-harm to gain a sense of control over their lives. And that kind of comes with like the binging and purging, or really any self-harming behavior. Typically when people feel so overwhelmed with all of these emotions and feelings, they feel like they have no control over themselves. And most people that I know like to feel some kind of sense of control over their own life. So if they feel that they don't, they know that by engaging in self-harming, that is something that they are able to control. So it helps it fill in that piece that was missing. They might do it to punish themselves for things they think they've done wrong. And I had mentioned that earlier. People who self-harm, typically they will blame themselves for things, situations that are beyond their control. So again, as a way to punish themselves, they will hurt themselves. And then they might do it to express emotions that they otherwise are embarrassed to show. So again, this is a lot to like with mental health. It's more common for people that are dealing with mental health to keep it to themselves just because they're worried about what other people might think, what they might say. And because unfortunately, there still is that stigma out there when it comes to mental health. I can't tell you the amount of students I've worked with that they tell me their families don't believe in mental health. They don't think it's a real thing. And they think that people that are experiencing any type of mental health issue, they're doing it for attention. So just by hearing my students, I can see why most people are embarrassed to, talk about those kinds of things because a lot of people just don't believe in it or whatever the case is. So again, they might do it to express those emotions to themselves so that other people are not aware. All right, so this is another little video about 6 reasons why somebody might self-harm.
Hey there, Psych2Goers. Before we begin, we would like to mention that this video was created with the intention of educating the community and supporting anyone that may be at risk of self-harm so that they may feel safe to seek help. As the topic of this video might be triggering for some, please be mindful in the comment section and help us make this a supportive and safe space for all. So, what is self-harm? Self-harm includes anything you do to intentionally injure yourself. Here are 6 potential reasons why people self-harm. 1. To feel something else. Oftentimes, when someone feels the need to self-harm, they're also feeling another strong emotion, whether it be anger, depression, or frustration. Physical pain, however, can be distracting. To them, the sensations of self-harm act as a temporary alternative to the emotional distress in order to avoid directly addressing the source. 2. To feel anything at all. Sometimes, though, someone feels so numb or drained of all feeling that they long to feel anything at all. According to the National Alliance on Mental Illness, self-harm temporarily fills a void and provides a sensation when someone feels empty, detached, or lethargic. The pain acts as a symbol of the emotional suffering that some are unable to experience. 3. To have a sense of control. A lot of anxiety and other symptoms of mental distress arise from feeling out of control over one's life. The choice to self-harm, however, is under their control. Feeling in the lead of one's own life and decisions is a comfort in itself, which may be why some make the choice to self-harm. This might make them feel in charge of their choices, their body, and even their life. However, this is a maladaptive coping strategy, which only serves to continue the disorder rather than healing it. 4. It feels like a relief. When someone is overwhelmed with feelings, the emotional release that comes from self-harm can feel a lot like relief. Despite any physical discomfort it might cause, the rush of hurting oneself can feel as cathartic as a hard workout. This may be why so many who self-harm once continue to do so. According to the Mayo Clinic, however, while self-injury can bring a momentary sense of calm and a release of tension, it's usually followed by guilt and shame and the return of the painful emotions. 5. It's a form of self-punishment. Unfortunately, some who self-harm do so as a form of self-punishment. They may believe that they deserve to feel the pain, or that they've brought their own suffering upon themselves. Perhaps they hope that feeling physical pain will dismiss the emotional pain, or that they'll become a better person by hurting themselves voluntarily. And 6, it's a way to communicate feelings without words. Feelings are not easy to talk about, especially if you're having intense emotions like those that can lead to self-harm. For some, hurting themselves is a way of asking for help or expressing their distress without having to use words. For example, someone told Mind.org, "I've learned that, as my emotional needs were not being met, I used self-harm because I didn't know how to express myself or say what I needed or what I wanted."
Hey guys, it's Yumi here, one of the partners of Psych2Go. I hope everyone is doing well, especially during this time. But good news is life is slowly getting back to normal and the world is opening up again. I actually have a special announcement to make, and that is we are launching our second channel called Psych2Go.
Okay.
Hey there, Psych2Go.
All right. Sorry. I was like, I don't know what was going on there. So when we look at the internet and social media and self-harm, so I know that there are people, more commonly the teens that I work with, they think that social media is everything. So that there's nothing bad that could possibly happen in the cyber world or on social media. So I'm always forever, I feel like, educating them on, internet safety, social media safety, just because there's a lot out there. And I feel like it is just continuously, like, there's more stuff coming on, happening and being created, and it's like you have to be constantly like watching out for all the new things that are coming out when it comes to the internet and social media. So not only are teens using creative hashtags, in their text or the apps, but they unfortunately are also sharing images and videos of their self-harm through these apps. And so the CDC found this new term. It's hashtag My Secret Family. And this had more than 1.5 million search results on Instagram alone. And I'll actually talk about what My Secret Family is on the next slide. Only 1/3 of relevant hashtags generated content advisory warnings. So a lot of people are posting things and they are not putting any type of trigger warning or content advisory warning before somebody watches the video. So they might think they're watching something completely different, but it could be a video of somebody that is showing off their self-harming scars or even engaging in self-harm through social media. So a lot of our social media apps, they usually have moderators that go and are constantly checking all the content in the feed and blocking or removing anything that goes against their policies. But the problem is these secret hashtags that they are creating. It's increasing and creating more communities of content when it comes to self-harm and other things that typically these apps would block because the apps are not seeing, they see these secret hashtags and when you read them, it really mentions nothing about self-harm. So it's kind of being skipped over by these moderators. And although there's a lot of self-harm communities and they're typically meant to provide support, and you see a lot of these online communities for lots of mental health, eating disorders, self-harm, depression, bipolar, anxiety. When it comes to self-harming, it's also turned into a thing where they normalize this behavior. And they might share methods of how to self-harm. And also they might share ways on how to conceal self-harm marks and scars on the body. So if anybody attended my eating disorder webinar, we had talked about the eating disorder websites that they called it Mia and Anna. So they would call it Pro Mia or Pro Anna. So basically on those websites, it was for anorexia and bulimia, but they were teaching people on, how to engage in eating disorders and giving them methods on, like for anorexia, like if you're feeling really hungry, how you can, help take that hunger away. So it was actually causing more harm than it was good. So here's the My Secret family that they have created. So they're basically, if you are experiencing any of these disorders, what you do is in the profile or the hashtags, instead of saying hashtag anorexia or, hashtag self-harm or suicide, if you identify as a female, they say you put this in your profile. And for boys or identify as a male, you put that on there. And so this secret family, although like if you just see these hashtag and these names, again, these moderators aren't going to associate that with anything that goes against that app's policy. So they're just going to kind of slide by it. But if they have these hashtags, they could be posting things about their disorder or something they may be going through that may not be healthy for someone that is also struggling with that as well. So this was a little news thing that I saw online. And this was just maybe a week ago. Oh, February 15th. So not a week, only like, I don't know, last week. But anyways, it was a really good article, but it was a 17-year-old, typical 17-year-old with social media and was on Instagram. And she, simply just liked some of these sad quotes that was on Instagram. And basically what was happening is by her liking these sad quotes, her algorithm of all of the things that people were posting started to partake in more of like mental health stuff, self-harming stuff, and suicide. So anybody that was posting anything about suicide, self-harm, or depression, she was seeing all of that. And basically she felt that she just got sucked into all of this stuff and kind of became surrounded by all of it. And it got to the point where she just started to break down and she started engaging in self-harm. And she also at times became suicidal and did attempt and had to go to a hospital. But basically, this just goes to show you that with the, our feeds on our apps, if we like something, then with the algorithm, they'll see that you like those things. So they're going to show you more of that content that could be similar. And so again, in her situation, it created more harm for her than doing any kind of thing that was good. So these are just some pictures that I have that show examples of what is being posted on our social media. So we have a couple of TikTok. So on the left-hand side, there's a girl showing her arm that is scratched. And then above, somebody that has carved in words to their leg. And then, there's just like quotes that they are putting on there. So this one says, see, no scars, but it's all lies. They only check wrists, not thighs. That's very common with self-harming. If they want to hide their self-harm from people, then more commonly they will cut on their thighs, because a lot of people don't check that area. And then on the right, these two girls on TikTok kind of glamorizing, like the one where it says, when it stings, way worse than the shower the next morning. So basically that was somebody that is, self-harming and just talking about, what it feels like. And then there's the guy that says girls self-harm, but so do guys. Another one that shows all their scars. And then in the middle, it said Madison Beer reveals she's 1 year clean of self-harm, an emotional Instagram post. So I'm seeing a lot of this too with a lot of the social media influencers. So if you're not familiar of Madison Beer, she sings and she became famous. Justin Bieber found her. And so although I think it's amazing that she has talked about being 1 year clean of self-harm, with these influencers, that's the thing, they can influence a lot of people. And so, the concern is if there are younger people that are influenced by Madison Beer and they think, oh, well, she used to self-harm, so it's okay. So again, there's a lot of influencers that are engaging or have engaged in self-harm of some type, and they're just now starting to talk about it. So it's just kind of worrisome, even though they're doing better, could their past influence younger people? So how to help yourself or a loved one. There are lots of things that can be done to help yourself or a loved one when it comes to self-harming. Really, one of the best things a person can do is understand what it is. Go online, do some research, learn how it takes different forms. It can affect anybody regardless of their background. And also recognize self-harm myths. So there used to be this myth when it came to suicide. Some people believe that you don't talk about it or you don't ask people if they have those suicidal thoughts because it'll plant that seed in their head. But that is not the case. And the same thing goes with self-harming. By asking somebody if they are self-harming is not going to plant that idea or that seed in their head. I have learned we do not have that kind of power over other people to plant those ideas. Typically, if we are asking those questions, if that was something that they had thought of, they have already thought of that way before you started asking them. The next on self-harm is it should always, always, always be taken seriously. People self-harm for lots of different reasons and motives, but it should always be looked at as a sign of distress and not be dismissed as them seeking attention. So instead of them being attention seeking, it should be looked at as attention needing. Unfortunately, I have heard from others a lot about, somebody that has a history of self-harming, and they might say they're dramatic, they're just doing this stuff for attention. I don't care if that's the case, whatever it is, there's obviously something going on with that person. So we should always be taking self-harm seriously. Make sure to look out for behavioral changes in a person. So this is just kind of a recap. So if they're wearing, clothes that they should not be wearing on hot days or, that are not appropriate for the weather, keep an eye on that. Brushing off injuries is just accidents or being clumsy. If they want to isolate themselves often, so they want to spend a lot of time alone. They don't want to be around people, their friends. If there's issues with their friendships or romantic relationships, so now they all of a sudden don't have any friends, maybe the relationship that they were seeing somebody has ended. If they have sharp objects with them on hand, If they start to withdraw from friends, family, things they used to love doing, now they don't want to do those things. And if they have unpredictable impulsive behaviors and mood swings. So when you are talking to somebody about self-harm, again, please learn as much as you can about self-harm. The more we learn, the better we are to try, or we're able to understand what that person might be experiencing and why they're doing that. So these are some really great websites that offer a lot of great information on self-harm. There's the Mayo Clinic, the National Institute of Mental Health. We have NAMI, which is the National Alliance on Mental Illness, and then the APA, which is the American Psychiatric Association. Before you go and talk to them, maybe rehearse what you want to say. This is not an easy conversation to have. And sometimes our anxieties and our thoughts and feelings will get the best of us. And maybe, if we don't rehearse what we say, then when we do talk to them, it might come off as us accusing them, which can just create a whole issue. Maybe we forget to make certain points that are important that we want them to know. So it does not hurt to write down the things that you want to say to them and maybe practice it. Make sure you set a private time and a place to talk. Don't do this in the middle of a store where everybody can hear this other person's business. Most people don't like their personal business being aired out for everyone to hear. Make sure you're being honest. Don't avoid or ignore it. Some people are really good at doing these things because they think, well, if I don't address it, then it doesn't make it real. And then if we don't talk about it, then hopefully it'll just go away. Especially if it's like a preteen or a teenager that might be engaging in self-harming. Sometimes people might mistake that as them just being hormonal teenagers, or they're just going through a phase. But again, it should always be taken seriously and it should be addressed. When you talk to them, make sure you try to use I statements. So you want to focus on behaviors that you personally have observed, because if you kind of point the finger at them and you are using you statements, then that person might become defensive. So instead of saying you're being dramatic, you just need to stop. You might want to go about it as saying, I have noticed, or I am worried. So you definitely don't want them to think that you're accusing them, because they may disengage from the conversation and be less likely to talk to you. Make sure you stick to the facts. Talking about self-harm is going to bring up a lot of intense emotions, and that can overrun the conversation. And so basically, the self-harming is essentially this person's friend, because if they are feeling overwhelmed, they turn to self-harm and it helps them. If they are sad, they'll self-harm and then they feel better. If they're angry. So essentially they look at self-harming as like somebody that's very, very close to them. And so if you are talking to them and talking about the idea of them stopping, it could bring up a lot of emotions. They could be scared, they could be embarrassed, different things like that. You want to make sure that you're caring, but also be firm. It can be very easy to be manipulated by somebody who is engaging in self-harm. Just like I had mentioned, they don't want that to go away because their self-harming has become their close friend and the way that they can cope. So they want that to stay around. So what's important though is that they need to be responsible for their actions and their possible consequences. And you want to try to avoid making rules, promises, or compromises. So don't say, I promise not to tell anyone. Or if you do this one more time, I'm going to do this. And they might say, I promise I won't do this anymore if you don't do that. So don't give in to those promises or those compromises. Next is to make sure to remove possible stigma. And that is really important. And I had mentioned that earlier, that there is still stigma out there for mental health. And so again, if we are coming off as like being judgmental because of how they are coping, again, they are probably going to shut down and they're not going to feel validated and they may stop talking about it. So it's always important to remind them that there is no shame in having mental health issues and talking about it, and that there are lots of other people that have been and will be diagnosed and they also recover. So just making sure that we're trying to move that stigma as much as possible is going to be important. Avoid overly simplistic solutions. So just telling them to just stop cutting, or everything will be fine. That is not helpful at all. That's just like if, somebody's dealing with depression and they're like, well, just don't be sad anymore. And you're like, well, if that was the case, I would have done that a long time ago. So those overly simplistic solutions do not work, and they are not helpful to the person that is going through it. They may feel misunderstood. They may not feel validated, angry. And again, it could further delay that process of them getting to recovery. Next, you want to be prepared for some negative reactions. And so again, you might come off as trying to take something away from them that they feel is the only thing that helps them. So they may become angry. They might try to play the reverse psychology and insist you're the one with the problem. They might brush it off or minimize their problems, saying that what they're doing is not a big deal or everybody is doing it. So regardless of how they respond, please know that if they have negative reactions, that this is totally normal. Again, they might feel scared, embarrassed. And so anytime we're put in a place where we feel like somebody is confronting us, we typically come off as kind of angry or upset because we're trying to, disprove them. So make sure you reiterate your concerns, let them know that you care, and leave the conversation open for them. Don't try to, immediately jump in and have them like spill all the details and come up with this huge, entire game plan. So make sure you leave that conversation open and allow them to talk about their feelings and their emotions. Encourage them to seek professional help. When it comes to self-harm, most people do require professional help to get better. So you can offer to help find a doctor, therapist, psychiatrist, a counselor, anyone like that. And getting timely and effective treatment can really increase a person's chance for recovery. So when I had talked about this behavior kind of becoming it could be a long-term habit or even more like addictive, the longer they engage in self-harm, the longer it might take for them to reach recovery. So it's important to get them into some type of treatment as soon as possible. The next is to tell someone. Never promise to keep self-harming a secret. I always tell students when I talk to them about self-harm that if a friend says, that they're doing this, to not keep that a secret. That should never be a secret that anybody should have to keep. So it's always important to make sure that, they go to a trusted adult, or that you are helping somebody seek professional help. So you want to try to get help right away. Get support from friends and family. And, dealing with this and trying to help, especially if it's a loved one, can bring up a lot of emotional stress for yourself. So it may be important for you to seek help and talk to a professional therapist as well while you're going through this whole process, because this can be a very, very tough road. And it could bring up just a lot. So it's always important that, if we're encouraging somebody to take care of themselves and get help, we should be doing the same for ourselves. Last, just please remember, mental health is a recovery process and there is no cure. I always think like, how nice would it be if there was that one little pill that just fixed everything? And I always tell people that if that pill existed, we probably would all be on that pill, but it's just not out there. And there is no cure for mental health, and self-harm is a part of that. There's no cure, and it's all about being in recovery. So it's going to be a process and it's going to take time. So you just want to make sure that you are patient with that person. So these are some helpful tools that somebody can use if they are engaging with self-behavior or self-injury. So mindfulness, practicing mindfulness. If you look up mindfulness, you will find lots of resources on deep breathing, guided imagery, progressive muscle relaxation. And then on YouTube, there is a channel that I absolutely love. It's called The Honest Guys. So it's a group of guys from Australia. They have hundreds of mindfulness videos, some that are quick, like 5-10 minutes. They have some that are 10, 12 hours long that people can listen to while they sleep. But they do all of the mindfulness things such as deep breathing, guided imagery, and the muscle relaxation. And what's really nice about that is you basically just put in some earbuds and listen, and they kind of guide you through these mindfulness things. So I absolutely love the Honest Guys, and I always tell people about them. Plus, they have a really cool Australian accent. It's just a very relaxing overall experience. The next thing you do is create a fidget toolbox. I actually do this for my students. I have a bunch of fidget items and I let them pick and choose some things so they have their own little toolbox. So fidget toys can be very, very helpful when it comes to trying to cope. And so some examples might be fidget spinners, fidget rings, squishies, anything squishy like the stress balls, or I have these little, they look like they're different animals and they're squishy. Infinity cubes, any type of Play-Doh, slime, clay, anything like that. It can be very helpful when if they're feeling really intense emotions. And these fidget toys can be very helpful at calming them down. They can also find new coping skills. So when it comes to coping, there isn't just like a set of like 10 things that a person can do to cope. There are hundreds of things that a person can do to find new ways of coping, but it's just going to be up to that person to figure out what is going to work best for them and what is not. So some examples might be taking a walk, listening to music, painting your nails, dancing, yoga, any type of physical activity, any kind of art, crafts, painting, coloring, things like that. Now, the next one, the harm minimization strategies. So I feel a little bit indifferent on these harm minimization strategies. So that includes, like, some people might put a rubber band around their wrist, and when they have that urge to hurt themselves, they will pull that rubber band and snap it on their wrist because it kind of gives them a little bit of pain, but it's not necessarily the same as with cutting. Pinching yourself, they might encourage people to draw or paint red lines on their skin because it looks as though they have cut themselves. Also holding ice. So if they're holding ice against their skin, it can create a burning sensation. And even though these are a little bit better than cutting yourself or burning yourself, in those types of ways, I would really err on the side of caution and suggesting these strategies to somebody that may be recovering or trying to work through the self-harm. And the only reason why is because, they might feel some kind of pain or sensation when they do these, but they may come to find that it's really not that helpful, or the pain doesn't feel as what it would if they cut themselves or burn themselves. So for me, I always worry about, if they were to do these things, then they could possibly, quote unquote, relapse and go back into self-harming. It's just like if somebody was struggling with alcoholism and you tell them to start drinking non-alcoholic beer. And so, okay, they might have a similar taste, but they may not have that same effects. But if the emotions are strong enough, then it could push them to that point of relapsing and actually getting, beer with alcohol in it. So research has shown that these tactics with the harm minimization strategies help some people, but for the most part, it's found to be unhelpful. So again, I always just err on the side of caution with that. And I would always, have a professional decide if this is something that that person should engage in or not. So this is a little example of the mindfulness. And so my coworker, Becky, had shared this with me, and this is really great. This is box breathing, and this is really a great tool to use on simple breathing exercise to kind of help calm somebody down.
There are times when we all experience feelings of stress or anxiety. In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier. There are times when we
Alrighty, so just to kind of follow up with some of the stuff I've been talking about, I absolutely love what I do, but I always get stuck talking about topics that are really difficult to talk about and aren't like fun. So I put in this video of an example of what not to do. So if any of you have ever watched the Bob Newhart show, this is a clip from one of the episodes. And when I was a therapist and I would teach other therapists on motivational interviewing, we would always put this in there, but it's just kind of a nice little breather from all the heavy stuff that we talk about.
Dr. Switzer?
Yes, come in. I'm just washing my hands.
I'm Catherine Bigman. Janet Carlisle referred me.
Oh, yes. Fear of being buried alive in a box.
Yes, that's me. Should I lay down?
Oh, no, we don't do that anymore. Just have a seat. And let me tell you a bit about our billing. I charge $5 for the first 5 minutes. And then absolutely nothing after that. How does that sound?
That sounds great. Too good to be true, as a matter of fact.
Well, I can almost guarantee you that our session won't last the full 5 minutes. Now, we don't do any insurance billing, so you would either have to pay in cash or by check.
Wow, okay.
And I don't make change.
All right.
And go.
Go.
Well, tell
What?
me about the problem that you wish to address.
Oh, okay. Well, I have this fear of being buried alive in a box. I start thinking about being buried alive and I begin to panic.
Has anyone ever tried to bury you alive in a box?
No, but truly thinking about it does make my life horrible. I mean, I can't go through tunnels or be in an elevator or in a house, anything boxy.
So what you're saying is you're claustrophobic.
Yes, that's it.
All right, well, let's go, Catherine. I'm going to say 2 words to you right now. I want you to listen to them very, very carefully. Then I want you to take them out of the office with you and incorporate them into your life.
Well, shall I write them down?
Well, if it makes you comfortable, it's just 2 words. We find most people can remember them.
Okay.
You ready?
Yes.
Okay, here they are. Stop it!
I'm sorry?
Stop it!
Stop it?
Yes, S-T-O-P, new word, I-T.
So, what are you saying?
You know, it's funny. I say 2 simple words, and I cannot tell you the amount of people who say exactly the same thing you're saying. I mean, this is not Yiddish, Catherine. This is English. Stop it.
So, I should just stop it.
There you go. I mean, you don't want to go through life being scared of being buried alive in a box, do you? I mean, that sounds frightening.
It is.
Then stop it.
I can't. I mean, it's been with me since childhood.
No, we don't go there. Just stop it.
So I should just stop being afraid of being buried alive in a box.
You got it. Good girl. Well, it's only been 3 minutes, so that will be $3.
Actually, I only have a 5, so
Well, I don't make change.
then I guess I'll take the full 5 minutes.
Fine. All right. Well, what other problems would you like to address?
I'm bulimic. I stick my fingers down my throat.
Stop it! What are you, nut of some kind? Don't do that.
But I'm compelled to. My mom used to call me fatty.
No, we don't go there.
But I've been having this dream.
No, we don't go there either.
But my horoscope did say.
We definitely don't go there. Just stop it. What else?
Well, I have self-destructive relationships with men.
Stop it! You want to be with a man, don't you?
Yes.
Well, then stop it. Don't be such a big baby.
I wash my hands a lot.
That's all right.
It is?
I wash my hands all the time. And there's a lot of germs out there. Yeah, don't worry about that one.
I'm afraid to drive.
Well, stop it! How are you going to get around? Get in the car and drive, you kook. Stop it!
You stop it! You stop it!
What's the problem, Catherine?
I don't like this. I don't like this therapy at all. You're just telling me to stop it.
And you don't like that?
No, I don't.
So you think we're moving too fast? Is that it?
Yes. Yes, I do.
All right, then let me give you 10 words that I think will clear everything up for you. Do you want to get a pad and a pencil for this one?
All right.
Are you ready? Mm-hmm. All right, here are the 10 words. Stop it or I'll bury you alive in a box!
All right, so as you can tell, that's not a very helpful solution when we're trying to help and talk to somebody by just telling them to stop. Definitely not going to help the situation. So some ways that you can get help. There are lots of resources that are out there. We have our crisis text line. The website has lots of great information. They have resources and they have 24/7 crisis support. And you can text home to 741-741. NAMI, their website has lots of great information on all sorts of mental health issues. and also self-harming. SAMHSA, that's our Substance Abuse and Mental Health Services Administration. Again, they offer great free resources on mental health issues and substance use problems. And then they also have a national helpline where you can talk to somebody 24 hours a day, 7 days a week. And then locally here in West Virginia, we have the West Virginia Crisis Support Services. So they offer resources and referrals for mental health and substance use through a database system. So if somebody is in need of some, like maybe some counseling or psychiatry, you can contact them and they'll be able to tell you if places that are in the area. And they also have a online chat support where you can talk to somebody 24 hours a day, 7 days a week. So if anybody has any questions, like they had mentioned earlier, we are going to compile all the questions and then I will follow up and send out all the answers to that. But if you have any questions about anything, related to mental health and youth or anything, if you need me to speak to students or whoever, please do not hesitate to reach out to me. My email address is there at awagner@missionwv.org. So I am more than happy to answer questions or help in any way that I can. So we have some upcoming webinars that I just want to go over. So March 17th at 2 p.m. we have our parenting webinar talking about healthy teen dating and red flags. So this presentation is going to focus on helping parents understand the dynamics of teen dating and how to spot any red flags that could point to an unhealthy relationship and possibly abuse. So this will also help parents learn how to navigate those tough conversations if you do see any of those red flags. April 7th, Puberty 101. I will actually be doing this presentation. So this is going to help parents begin to learn about puberty and having that talk with their kids. This is always such a not fun time. Like nobody could pay me enough to go back to that age. And I know for parents, sometimes this can be a tough topic to talk about. But parents will learn the tools to work together with their children and opening up those lines of communication and then learning about hygiene, self-care, working through negative self-talk and the basics of menstruation. April 21st, I will also be doing this presentation on puberty and mental health. So we know that during the time of puberty and being a preteen and a teenager, sometimes kids can be a little bit moody and sometimes it can be difficult to understand and determine if it's a mental health issue or if this is typical puberty behavior, teen behavior, things like that. So in this webinar, I'm going to talk about how to understand the differences between mental health and puberty and what to look for in certain mental health diagnoses and whether or not you should seek professional help. May 4th, we have our teen pregnancy prevention program on the realities of what we do and why. So in this presentation, some of our educators through the Think program basically are going to put on a presentation about what they do and why they do it. We had talked about earlier how important our Think program is and how much work we do for the youth in our state and teaching them about healthy relationships, communication skills, and pregnancy prevention, drugs and alcohol, different things like that. And then May 13th, we have the Ask the Educator, and this is for parents. So this will be done by my coworker, Anna, who is an educator, and then I will also be on there to answer questions regarding mental health. But we know that there can be a lot of barriers to parenting, and it can be stressful at times. And basically with the Ask the Educator, we will take your questions in advance. Any questions you have about raising kids, teenagers, anything like that. And then we will help you learn how to effectively support your middle and high school students. And then we will have an open floor for a Q&A. So this is really just kind of an open forum. So if you have any questions or concerns when it comes to preteens, teenagers, this will be a great place to ask those questions. So that is all that I have for today's presentation. I greatly appreciate everybody's attendance. I hope you guys learned some stuff. And again, if you have any questions, please do not hesitate to reach out to me.
Okay, before you sign off today, just a reminder that to get your CEUs and to help us, there will be several links, the QR code, the link will be sent in an email about doing an evaluation. And also, we've gotten a lot of questions in the box about, will this presentation be available to review? And can you have a copy of the presentation? And those links and that information will be sent out with the follow-up information, the follow-up email. So if you don't get that information, please contact rwhite@missionwv.org or Autumn or myself, and we will make sure you get that information. Once again, thank you so much for taking the time to attend our presentation. And I know I learned a lot, so I hope we all learned something today. Have a great day, and we'll see you next month.